And welcome to today's webinar, Current Challenges in Childcare. We appreciate your attendance today. It seems as if there's never a dull moment, so we look forward to sharing the results of this survey with you over the next several minutes. Just a few reminders at the outset. First, I should mention my name is Tony Feltz. I'm with Early Learning Indiana. We'll be hearing from Amanda Zimmerman with the responses to the survey that many of you took at the end of August into the early part of, well, at the end of August. Just a few housekeeping items. All of the attendees today will be muted throughout to ensure that we get the best audio quality and minimize background noise. We'll answer questions at the end of this webinar. Please type questions into the box on the right-hand side of your screen, and we'll get to those at the end of our presentation today. And then just a reminder that more information will be available to view after this broadcast on our website, earlylearningindiana.org, and you see the entire web address there at the bottom. So with that, again, thank you for attending, and I want to introduce Amanda Zimmerman, who is the Vice President of Portfolio Initiatives for Early Learning Indiana, to walk us through the survey results. Mandy?
Hi, everyone. Thank you for joining this webinar today. For those of you who are providers, thank you for participating in the survey and staying engaged in the results. Before we dive into those results, I want to set the stage a bit for you. We all recognize the importance of high quality early learning, and we've been measuring that for several years through our Closing the Gap reporting. A few recent developments have made that access more precarious as pandemic-related funding has run out, and the state is not currently issuing any new CCDF vouchers. Additionally, you may have heard the state's announcement this morning that they plan to reduce reimbursement rates to providers starting next month. And so all of these issues, alongside long-term challenges related to workforce and affordability, have created a really precarious environment for early learning providers. And that leads us into why we issued our recent survey. Given the challenges in our current state, we found it especially important to hear directly from providers about their experiences. We sent outreach far and wide, and more than 400 of you from 67 counties responded with completed surveys. Those 443 responding providers represent about 15% of our state's childcare capacity, predominantly within registered ministries and licensed centers. So jumping back into our survey results, like I mentioned before, we found it really important right now to hear directly from you all as providers about what you're experiencing right now. We sent our outreach far and wide, and more than 400 of you from 67 counties responded with completed surveys. And so those 443 responding providers represent about 15% of our state's childcare capacity, predominantly within registered ministries and licensed centers. Based on survey results, 78% of respondents reported decreased funding through Child Care and Development Fund, or CCDF, vouchers, coinciding with the expiration of federal pandemic relief. Running in parallel to that, providers also noted declining enrollment, with only 16% confirming full enrollment. Those declines showed up across various age groups of children served, as you can see in the year-over-year declines, with the most decline reported in the number of preschool or pre-K children being served. More than half of providers also reported the number of infant and toddler children they're currently serving has declined since last year. As I mentioned earlier, we wanted to share your voices as much as we could. And so throughout this presentation, you'll see quotes we pulled directly from your responses related to the themes that we've analyzed. As it relates to declining enrollment, one provider said, "Our CCDF enrollment dropped by 50%. Families who would like to enroll cannot afford to." Another said, we're barely keeping our doors open. We used to be at full capacity as a program at 80, and now we are under 50. Declining enrollment threatens a program's sustainability and therefore access to early learning for all children, including those most vulnerable. We also asked providers several questions related to classroom closures. Providers generally choose to close classrooms because of some combination of two factors, lack of teachers to stay in ratio and or a lack of enrolled children. What we found is about 19% of respondents have at least one closed classroom, and even more have classrooms that are operating in single ratio or half of what they typically might be. All provider types reported closures, and they were most prevalent within ministries and licensed centers. And this is important because those two provider types make up about 3/4 of all statewide capacity. These are two more quotes to illustrate the relationship between staffing and enrollment. You can see here, if we are not able to find private pay children to enroll to replace the CCDF on my way children we normally have enrolled, we will have to reduce the number of classrooms and reduce staff members. Another respondent mentioned, we saw an unprecedented decrease in enrollment after 5 years of continual growth. If we cannot recover most of the lost revenue in the coming years, rooms will need to shut down and we will lose good qualified teachers because of lack of demand. As it relates directly to staffing, there are an abundance of open positions throughout the state at present. In total, respondents noted 396 full-time openings alongside 255 part-time open positions. While these openings were reported across rural, suburban, and urban areas, they're particularly prevalent in urban counties such as Marion, Lake, and Allen. We know that staffing is a long-standing systemic issue in our field. We also know that teachers are more likely to feel burnout, leading to overwork and attrition when staffing is low. As one respondent said, we will not be able to enroll more children if we cannot find qualified staff. Another mentioned, if we are unable to fill the open teaching positions, we will start to lose other staff from them becoming overworked and burnout. We have vacancies in our support staff positions, so that means full-time classroom teachers are not getting planning time or support for challenging behaviors. These will add up quickly and cause burnout to happen faster. Financial pressures have led many programs to eliminate family engagement activities and reduce operational services like janitorial or cleaning services. When we asked about family engagement activities like workshops or family events, 39% of respondents indicated that they have reduced or eliminated such activities. 25% have also reduced operational services related to cleaning, which are critical components of maintaining healthy and safe environments. In addition to not providing diapers, we had to cut our cleaning service and have teachers clean their own classrooms. We want to not let our enrolled families feel our cuts. We decided the cleaning crew was the next service to cut. We aren't making ends meet, so instead of sacrificing pay for teachers, we are cutting back on resources. Common themes in responses centered on financial pressure related to lower enrollment, rising operational costs, and loss of CCDF vouchers as contributing factors to making these cuts. As we think about overall program sustainability, 16% of respondents indicated they plan to close classrooms. 11% anticipate closing their programs entirely, and 3% are considering merging or consolidating with another program. If all of those anticipated program closures happen within the next year, we'll lose about 1,400 seats solely from those providers responding to this survey. We recognize that the providers at the greatest risk of closure might have been more likely to complete our survey, and that's a limitation in what we know. However, if we look at the proportion of survey respondents who think their program might close, and we assume that that proportion holds true for all providers, we can anticipate a loss of nearly 10,000 seats if conditions remain unchanged. To drive home these points, one respondent said, "Our biggest concerns are that families who need quality care will be forced to place their children in unsafe conditions solely based on what they can afford." Another said, "The abrupt end to CCDF has almost shut our doors. It is affecting the workforce, and it is going to be detrimental to our families and community." As I mentioned earlier, we did pull key themes from these respondent comments. These are some of the themes displayed here we identified when we analyzed answers to the question, what are your biggest concerns about sustaining your program long-term? Many of these we've already discussed today, with respondents sharing concerns about funding, enrollment, affordability, and staffing. All of those lead to worries about sustaining the program and sustaining at the same quality level. Additionally, several discussed policy changes related to CCDF and how those changes impact the work they're doing. All right, so at this point, I'll ask my colleagues who are managing the question box if there are any questions from the group today that I can take at this time.
Okay, thanks, Mandy. First question that we have a few times in the chat, is county level data available?
Yes, great question. So we were so pleased at the response to our survey. Having over 400 responses in less than 2 weeks is really, really valuable information for us to have. However, those responses are scattered across the state and not in a way that's consistent. So for some counties, they might have a lot of responses, others have fewer. And so for that reason, we made the decision to bring all of the responses together into a statewide analysis and not really dive into the county level responses at this time. Thank you so much for that question, Tony.
And another one that came up a few times, can I share this information with others?
Absolutely. You can find the survey summary on available on our website. You'll see the link on your screen. Also happy to answer any questions you have or thoughts that you have about what you're reading in the survey summary. You can always email info@earlylearningindiana.org for any of those additional needs.
And looking at one more here, will you be sending additional surveys to understand ongoing impacts?
This is a really challenging environment, and we know that things are changing quickly. Sometimes it feels like they're changing day by day. And so we want to make sure that we are continuing to hear from providers on a regular basis. My hope is that we do issue another survey later this fall. And when that happens, you'll be notified via email and via Early Learning social channels. And we would just thank you in advance again for your participation and your partnership in this work.
And I think that is all we have as far as recurring questions in the chat, Mandy.
Great, thanks, Tony. And thank you again, everyone, for joining us today. As a reminder, check out our website for the survey summary. Feel free to email us with any additional questions. And thank you so much for your time this afternoon. Have a great day.